Americans wear corrective lenses. Chances are a large percentage of you watching do too. But if you're like most people that must rely on corrective lenses for sharp vision, you know it can be inconvenient as well as expensive. Now there's a new way to see, a life without dependence on glasses or contact lenses. It's called laser vision correction, and it's performed by Dr. Birchansky here at the Fox Eye Laser Vision Institute in Cedar Rapids. Are you a candidate for laser vision correction? Stay tuned to find out.
Welcome to Laser Vision Correction by Fox Eye.
By now, you may have heard about laser vision correction, but may not know exactly what it is, what it involves, or where to go for more information. Today, we'll explain laser vision correction, and we'll watch Dr. Birchansky perform LASIK surgery on a patient. We'll follow the process from start to finish and explain who is a candidate. We'll also take your calls and answer questions, so be sure to jot down the number on the screen. Our experienced staff is waiting to take your calls now. Imagine a world without the inconvenience of wearing glasses or contact lenses. A world that looks sharp and crystal clear from the moment you open your eyes in the morning until you close them at night. To experience this, those of us with vision disorders have had to rely on corrective lenses, until recently. Now, laser vision correction is an alternative for those of us who are either farsighted or nearsighted with or without astigmatism. It's a simple procedure done in the comfort and convenience of Fox Eye's office setting with no hospital visit necessary. Dr. Birchansky's reputation for excellence in laser surgery is known statewide, and thousands of Iowans have chosen his surgery and now lead a life free of glasses and contact lenses. Laser vision correction restores your vision to its natural state without the aid of corrective glasses or lenses. There are two methods of treatment. One is called PRK, which treats the surface of the cornea. The other is called LASIK, which treats the tissue beneath the corneal surface. Each procedure uses our Summit Apex Plus Excimer laser. It is proven to be safe and effective, and Fox Eye Laser Vision Institute is the only clinic in Cedar Rapids to use this FDA-approved laser. In PRK, the excimer laser emits a rapid succession of laser pulses. With each pulse, microscopic layers of tissue are removed from the surface of the cornea. The laser precisely reshapes the corneal surface so that light will focus properly on the retina. LASIK stands for Laser-Assisted In Situ Keratomalusis. This procedure combines traditional surgical techniques with laser treatment. This treatment is also known as flap and zap because the doctor will slice a thin flap across the front of the eye, fold it back, and shape a deep layer of the eye with the laser before replacing the flap. The flap adheres to the new shape beneath, resulting in better vision. In a moment, we're going to meet Tom, a candidate for the surgery who is ready to lead a life free of corrective lenses. We'll take the cameras into the laser suite to observe the vision correction surgery from start to finish, a procedure that only takes about 15 minutes.
Call Fox Eye Laser Vision Institute now. Technicians are on staff ready for your calls. Call toll-free at 1-800-ICU or locally at 362-9855.
I started wearing glasses when I was about 8 years old, and I'm a very active person. I like to play tennis and play golf and jog, and I do quite a bit of hunting. And all of those things are a lot of fun, but they're not much fun when your glasses are sliding down your nose and fogging up. And people who have worn glasses as long as I have understand when I say that they can be kind of a pain when it comes to outdoor activities. So a couple of months ago, I started researching LASIK surgery, and I called Dr. Birchansky's office to see if I might be a candidate for the surgery. I went in for a consultation. The staff was extremely helpful, learned a lot about the surgery, found out that I was, in fact, a candidate. And I left the office that day feeling quite confident when it comes to the surgery itself. I like the idea that it can be done in the office. There's not a hospital stay required. It's very quick. The results are quite quick. So basically what I've had to endure for the last 40 years, they can fix in about 13 minutes, and that excited me. So I really look forward to the day that I can wake up in the morning and see the clock and see my son without wearing my glasses. And that day's just right around the corner.
Tom took the first step toward visual freedom by picking up the phone And like Tom, you too could be just a phone call away from a hassle-free life. Be sure to jot down the phone number so that you can find out if you are a candidate for laser surgery. Next, to show you just how comfortable and quick laser surgery is, we took our cameras into the laser suite to follow Tom's surgery this last week. Let's watch as Dr. Lee Birchansky performs laser vision correction right here at the Fox Eye Laser Vision Institute in Cedar Rapids.
I'm about 5 minutes from the surgery. I've had consultation again with one of the staff members. We've remeasured my eye. He put some antibiotics in my eye to fight infection. In about 5 minutes, they're going to take me in, and I'm looking forward to successful surgery. I have all the faith in the world in Dr. Birchansky and his staff. They've made me feel very, very comfortable, and I am very excited to get on with this and to get these glasses off of my face.
Due to time constraints, we join Dr. Birchansky as he completes laser eye surgery on Tom's right eye. Next, we'll see laser vision correction in its entirety on the left eye.
Perfect fixation. Beautiful. We're all done with this eye. Everything went perfect. We're going to wait 5 minutes, okay?
Unbelievable. You bet.
Very nice job.
Thank you. You too.
Okay. Well, now you know exactly what to experience for your left eye. It should even be easier for you, right?
I'm a lot more relaxed now. That was
Good.
nothing.
Good. I'm going to be taking off the tape, okay?
Sure.
Look down just a little bit. Good. Hold it right there. Keep your eyes closed now for me. Great. Thank you. We're going to be taping the right eye shut,
Okay.
and we'll untape the left eye. We're just going to move the microscope over your left eye. Okay. Minus 1.5, minus 1, M1, vertex and system hold, axis 15, 10% pre-treatment, axis 95, 95, thank you. We're going to be taping the eyelid open.
Okay. You have very, very steady hands.
Well, thank you.
Thank you.
You're welcome. Caffeine is definitely not part of my diet.
That's good.
Yeah, let's go ahead and give him another drop of anesthetic, please. Thank you. Okay, I'm going to squirt the eye with some cold water.
Okay.
Okay, now you see that green flashing light?
Yes, I do.
Okay, that's not going to be as sharp, just like before, once we create the flap, but that's the light that you'll eventually be fixating on.
Okay.
Put aspiration off, please. Thank you. Okay. Good. Your vision's going to be getting dim again, okay?
Okay.
Put switch start. Check applinator.
Applinator's homed.
Put switch start. Closing vacuum. Vacuum is 680.
Okay. Let's see, we're at, is your vision dim?
Yes.
Okay, good. We're at 9.3.
9.3 is entered.
Thank you. You can hear a buzzing noise. Hold real still for me. Okay. Great. Everything went very well.
Vacuum releasing.
Apparator home. You're going to feel some cold water again. Good aspiration. Thank you. Good aspiration off, please. Thank you. You can prepare another sponge for me, please. Okay. You're doing great. Just dim the light for me, please. Okay, don't move your head. There you go. That's perfect. Hold it right there. Fixation is perfect. Hold it right there. Beautiful. We're all done. Everything went perfect. Lid aspiration on, please. Thank you. Give me one more light, microscope light, please. Thank you. Get ready for the Ocuflox, please. Thank you. Put aspiration off first. Ocuflox, please. Thank you. Okay, everything went perfect. We're going to wait 5 minutes, okay?
Okay.
Well, you are going to be extremely pleased tomorrow morning when you wake up. You're going
Looking forward to that.
You're going to have that wow factor. You're going to say, wow, I can't believe it. I can see.
All those years and it took so little time to fix it.
Right. So today when you get home, you'll probably just feel like sleeping.
Yeah,
And
that's okay.
later on, within a few hours, you're probably going to start to notice some improvement in your vision.
Okay.
But I usually ask my patients just to relax with their eyes closed and not use their eyes for any activities other than just eating or bathing. This is the boring part for me and you. Okay. All we do is wait.
That's fine.
The flap should be pretty well adhered after 5 minutes. And then we'll keep you here for another 45 minutes. Check your flaps before you leave to make sure they haven't moved.
Okay. Okay.
And then we'll see you back tomorrow morning.
They adhere that fast, huh?
Yes. Yeah. Once you look down just a little bit, there you go. Look straight ahead for me. Straight ahead. Good. Look down. Good. Keep your eyes closed. Excellent.
Okie doke.
Well done. Did great.
Thank you.
How do you feel?
I feel fine.
Super.
Yeah, I feel great.
Take this little hat off your hair.
Okay.
Tom, we're going to have you get up slowly so that you can go ahead and open your eyes. Go ahead and get up slowly. You can kind of just swing around. Why don't you just sit over here for just a second before you get up, and then we'll take you back over to the exam room, okay?
Good.
Okay.
You're a little blurry.
Okay. But you can see, Woody, right?
can see, yeah.
Okay. Why don't you go ahead and keep your eyes closed for just a second, okay? Good.
Thank you very much.
Sure, you're welcome.
Okay, we're going to have you open and we're going to bring you this way.
Good.
Careful getting down here. Follow me.
Water constantly, is that something that can be corrected?
Mike, there's a lot of reasons for watery eyes. Sometimes it's just eye irritation. We have the patient go through a series of tests to evaluate where this tearing is coming from. Sometimes the drains of the eye, the aspect of the eye that takes the tears down into the nose and mouth is not functioning properly, and we have to do a minor procedure or surgery to correct that.
I don't know how common this is, but someone who has the concern that they feel their eyelashes are really rubbing on the eyeball.
Right.
Is that something
It
that
actually is fairly common. You know, a lot of times patients come in and they do notice this foreign body sensation. It's their lower lids usually that are rolled in against the eye. It's because the lids have lost that tone that they normally have. And what we do to correct that is actually tighten the lids up and put them in the proper position.
What about a small bump on the eyelid, upper eyelid? Is that something that's fairly common?
Oh, absolutely. Probably every day I see a patient with, you know, some sort of mass around their eyelids. Sometimes they're more concerning, and that is to say that they've had a change in shape, color, various qualities, such as they might be bleeding a little or scaling, and those sort of things, you know, should be checked out.
Well, this isn't related to the eyes specifically, but the wrinkling of the forehead. That's related to lifting the eyebrows?
Oh, yeah, absolutely. And again, the forehead's all involved with the eyebrows. It does lift the eyebrows, and that's why people kind of get this sort of appearance, particularly as they age. There are a lot of things they do for that, including the injection of what we call Botox, a botulinum toxin, which, again, sounds scary, but really is quite safe. That helps to relax the muscles and really smooth out those wrinkles. Also, sometimes I'll use laser or maybe even something we inject into the area to fill those wrinkles.
Well, we haven't covered every conceivable question, but I'm sure you'd entertain a phone call, wouldn't you?
Oh, absolutely. And again, I do, in the Gazette, have a weekly piece where I actually answer a question from a reader or someone who wants to call in.
Thank you very much, Doctor.
Okay, thank you.
I have always wanted to have eye surgery. As you can tell, I've got these big bags, droopy eyes here and these bags under here. I've had them all my life, but as I get older, they get more and more obvious. In the past, to find someone that I felt that I was comfortable with and that I felt was experienced enough, I probably would have had to go to Chicago. However, now that we have Dr. Stanglin in town and I've gotten familiar with him, I'm very comfortable with having him do this blepharoplasty on me, and I'm very excited about it.
Well, AJ, as you know, we're about 3.5 weeks or so after your surgery, and I think we very much accomplished what we set out to do, which is to say that for your upper lids, we took away the tissue that was present there and hanging down. We also, in addition to sculpting that and removing the fat, we also raised the lid creases that are present and trying to give you that nice high-arched feminine appearance, and I think that looks very good. For the lower lids, again, I think we did an excellent job in removing and sculpting the fat tissue that was present by making that incision inside your lid so that there's no external scars.
I came in that morning excited, planning on coming out looking good. The procedure was really very painless. The nurses, his staff, all take such nice care of you. It was over pretty shortly. I went home, spent the afternoon resting, and went back to work a couple of days later. So the whole procedure was really quite quick. I'm really impressed that at just 3.5 weeks that it looks as good as it does. You know, it doesn't look like plastic surgery, and people will say, "Oh, you really look nice today," and you look so rested, and they don't quite realize what it is. And I think that's the beauty of it. I would recommend it to anyone.
Fox Eye Laser Vision Institute in Cedar Rapids offers state-of-the-art laser vision correction and now ophthalmic, plastic, and reconstructive surgeries in the comfort of an office setting. The convenience of financing plans and our caring staff make your experience at Fox Eye all the more positive. Are you a candidate for laser surgery? Call now to find out and take the first step toward a lifetime of better vision. Thank you for taking the time to learn more about laser vision correction. This is Mike Pace, and I'd like to invite you to join the thousands of Iowans who now lead a life of visual freedom through laser vision correction, available through Fox Eye.
Call Fox Eye Laser Vision Institute now. Technicians are on staff ready for your calls. Call toll-free at 1-800-ICU or locally at 362-9855.
Isn't it time you lose the glasses? Call Fox Eye for an information pack and then join the thousands that have come to Fox Eye to correct their vision. Fox Eye Laser Vision Institute.